Hey everybody, welcome into the October 2024 edition of Carallel's Caregiver Conversation series. Matt Perrin, Director of Caregiver Engagement, back with you today. Have an old, long-lost friend with me for this session and coworker, Perry Mims. Hey Perry, how are you?
I am great. I am so happy to be here.
Thank you. Thank you for being here. We appreciate it. If you've been attending these sessions for a while, you probably recognize Perry's smiling face. She used to do a lot of these with me, and glad to have her back. She is a care advocate here at Carallel, a certified dementia practitioner, so much more behind the scenes, and just all around fun person. So she's not only knowledgeable about today's topic, advanced care planning, but I have a blast every time I talk with her, and I think you guys will too. So, little housekeeping real quick before we jump in, Perry. So, if you are joining one of these sessions for the first time, glad you're here. Thanks for coming. We're Carallel. We're a caregiver support company. We help family caregivers with whatever's on their plate. Is the short of it, and we do it in a couple of ways with our support line, which is staffed by our team of care advocates who are caregiving experts, helping people with, again, whatever is on their mind, weighing on their shoulders, tasks they have to get done, helping with all of it. We're here for caregivers. Well, caregivers are there for their loved ones. And we complement that one-on-one support with our digital experience, Carallel Companion, which is a mobile app that is, I think, like having a care advocate in your pocket. So that's where I'll leave it. And we make our service available through insurance companies and employers across the country. If you know you have access, great. If you're not sure, ask your employer or ask your health insurance provider if they offer Carallel as a benefit. So that's number one. Number two, broken record alert here, but these are conversations by design. You're not going to see any slides today. We're just having some real talk about what we think are important caregiving topics. So we'd love you to be a part of that. Chime in, ask questions, use the chat function down at the bottom of your console. We'll be monitoring that throughout. So, all right, Perry. Advanced care planning. So what's our focus today? Trying to be practical. We want to just level set on what it is, and in the
Sure.
process talk a little bit about what it isn't. We want to and dive a little bit deeper in terms of how people can think about it and take some action steps towards getting started. So first question to you is, what is advanced care planning?
It's a big word for something that's just super kind of simple in its own way. And it's legal documents. And pretty much what it does is it kind of states what your wishes are for your future medical decisions. That sounds boring, but we can't always know when we're going to need something like this, whether you're a caregiver or a care recipient. So it's really a way to just guide your family and the healthcare professionals around you to help follow what you would want if for any reason you can't speak for yourself at that time.
Love it. And I love the way you put that, because it's funny you mentioned the piece about guiding. I actually, how can advanced care planning be so memorable? I don't know, but I have a very vivid memory of my caregiving experience. I was at a doctor's appointment one day with my mom and her primary care. It was very early days in her life with dementia. We were seeing some changes, but not a ton at that point. And the primary care looked at me and said, "Well, have you guys done your advanced care planning?" And my eyes, I'll never forget how my eyes rolled over in my head, just because the phrase, it sounds so big and formal, and I wasn't getting it. And she finally said, "Well, look, this is if it ever gets to a point where your mom isn't able to speak for herself, make her own decisions, this, all I'm talking about here is a guide for you to make the decisions you think she'd want to have made if she can't make them herself." So, but I have vivid memories of that I have a lot of eye rolling moments in my caregiving years, but that was one. Just because it sounds so formal, advanced care planning. It sounds like you need a medical degree.
100 or an attorney, like you have to
Yeah,
be.
right, right. Absolutely. So,
Yeah,
question for you though, is it just for older adults?
no.
Like who should be thinking about advanced care planning?
So you mentioned it got brought up to you in the doctor's office because you were there with somebody with a particular diagnosis, a family member with a diagnosis. You don't have to have any particular type of diagnosis or illness. You do not have to be you don't have to be over 65 or anything like that. These are things like even as a parent of smaller children, I didn't think about it until I had kids, but it kind of went along with that planning of what would I want my husband or my family members to do if, heaven forbid, I got in a car accident. So it could be something that comes up in an emergency. It could be something that you just really allows you to have that conversation with your loved ones because often we don't talk about these things. We might know what we
Mm,
want in our minds, but we don't say it out loud, or we make the
mhm,
assumption that somebody thinks the exact same way that you would about it.
mhm.
It's really important to have these conversations really at any age, any condition.
Yeah. Such a good point you make there, Perry, on there's this gap, and I felt this really strongly. I was an only child. My mom was a widow at a young age. It was just her and I. We were super close, super, super close. Could talk about anything. But even in that context, it took some like I felt like I had a good feel for what my mom would want or not, but I didn't know for sure until we had these conversations. So that's a really, really, really good point there. Um, so just to recap, it's for any um, any adult, any age, any stage of life. It's
It
there's
is,
yeah.
but like if like you're part of this conversation, you're listening to this and it's something that you don't have, it can feel even more important when you are caring for somebody that does have a condition or if they haven't put this into place, like that might be a red flag for you in the moment. But yes, altogether everybody should do this.
Yeah.
But especially if you are listening to this and you think, oh wait, I don't have this, or my loved one that has something else going on doesn't have this, it could be a little motivating as a time to make sure you kind of cross it off your list.
Hmm. Yeah, and I think there's some at least in my case there was some peace of mind that came with it as well, which was sort of I guess an unexpected benefit. But
For sure.
when we like the old adage, every little bit helps, applies to so many aspects of caregiving, including sort of getting those um, little sources or flashes of peace of mind or confidence or comfort.
So
Um,
much confidence, so
yeah,
much confidence that you're
yeah,
doing what you now know your loved one
for,
would want.
right, right. Okay, so let's talk about it. Because I think like if you Google advanced care planning, like the emphasis is on really on the legal documents, and that was one of the first two words you said when I asked you the question. And hopefully people can kind of see where we're going here, but it's really yes, it's legal documents at the core, but it's more than that, right? It's discussions, it's making decisions, and then it's documenting. So let's talk about the discussion because it's a heavy topic, right? Like,
Well, it's a very heavy topic, but it can actually be a pretty pleasant discussion. I know this sounds strange, but having the opportunity to talk about what's important with you or to you with a loved one can be kind of like it can be kind of inspiring to find out things about your loved one in that situation, like what they would want, what they don't want, what they consider quality of life. That's one of the things that
mm,
comes out of it, which is so important. Um, and so, like, while opening it up, it seems a little like of a stiff or uncomfortable thing, but as soon as you start kind of talking it through, it can actually be a really lovely thing to just come to terms with.
Yeah. Um, okay. And like, what about tips? I was just such a bad, I got a lot better as my caregiving went on, but I sometimes struggled with with having these conversations. My bull in a china shop sort of approach to having these conversations didn't really, like, it wasn't the most effective. So what are some, heavy conversation as we talked about, but like what are a couple tips for people to be thinking about, you know, setting, when to do it, how to do it, all that sort of stuff.
Yeah, totally. You don't have to be in a lawyer's office. You can be in your house. This
Yeah.
is just a conversation to start off with. It's between you and your loved one or whoever else is involved in their care, so you're all on the same page. It doesn't have
Hmm.
to be formal or stuffy. Um, the forms to fill out, some of them will come with conversation guides to like
Hmm.
prompt you on good ways to approach it. Again, conversational, like warm, open.
Hmm.
And also, like, don't get ahead of yourself. This is a good time to just be like, let's hear what my loved one has to say, not
Hmm.
necessarily leading them to a certain decision or not that's in line what you think they want or what you want, but kind of just
Right.
letting them give you the answers that is best for them. And what it that might allow you to do down the line is be really respectful of that. Um, it's a whole conversation for another time, but following through on the wishes that exist for your
Yeah.
loved one.
Yep.
But I think starting off with just kind of being open, conversational, why it's important to you. If let's say you're talking to your mom, you're like, hey, mom, I want to know these things so that if I'm in the room and I need to make this decision that I can be confident I'm doing the right thing for you. I'm doing what you want and I'll know that I'm respecting you. Just
Hmm.
having that kind of approach is a really good way to kind of start it off.
Yeah, I love that. And I would also think when we talk about communication a lot in this series, but also just every day, I'm sure you do with your work with family caregivers, but some of the I guess fundamentals of having these conversations would apply to just being mindful of, when, maybe at the dishes at Thanksgiving, at the sink doing dishes at during Thanksgiving isn't like the best time to strike that conversation up. It's, you want to make sure you're at a time when you're maybe not necessarily going to be rushed, and it's a calm environment, or whatever calm looks
Absolutely.
like to you. Um, so those sorts of things would certainly apply. And then I want to just hone in on something you said around the decisions and some of the tea leaf reading I was doing and what you were saying, because I also found this to be somewhat of a challenging part of this was, because, as I was saying earlier, I felt like my mom and I were sort of attached at the hip, and I was almost, as we were getting into these conversations, like I would ask the question, and I'd have a preconceived notion on what I would hear from a response from her, or what I should, to your point, based on what I was feeling, and uh, that was hard to sort of strip myself of, I guess, is the way I'd put it.
Yeah.
So like the the decision making part, it's a discussion, or discussions, probably more accurately, decisions. That part was tough because you really just have to, it's their decision, right? Like, you
Yeah.
want to like help them get there if help is required or needed by them, but it needs to be their decision. So like, I don't know, any thoughts on how people, like, is it just as simple as like bite your tongue? Like, ask the questions and let them go?
Well, I think it's good that you said discussions instead of discussion because
Yeah.
yes, this can take place over time. This is not something that has to be like we need to get each one of these answers right now in this room at this moment.
Hmm.
I think what's helpful sometimes is bringing up situations. And again, a lot of times there are these guides that'll help you, but like that kind of decide where your loved one wants to, draw a line is a strong way of putting it, but like where they are on that balance between trying to, is prolonging life more important to them than possibly the quality of life, and where in that do you fall? So bringing up specific situations of like, hey, mom, if this exact thing was happening, what would you want?
Mm.
Or, and kind of bringing up specific possible situations, because then you get to watch them think it through, and you can really see it through their eyes, and it gives you an understanding of where they're coming from. So yeah,
So,
and then once you have that and on all that information, and kind of deciding what's most important to them, which again can be a really just good thing to know from day to day. Like, it does open up nice conversations on the side, but then the next step is really kind of documenting what those wishes
mhm.
are. Um,
Yeah,
yeah, but
sorry.
have the conversation first and then dive into the documentation.
Yeah, sorry for the glitch there. You caught me. My dog was barking. It's
Oh,
2024, in my home studio here.
I'm
But
always happy to keep talking.
yeah, you were just, that was very professional. You were filling the space. It was great. Um, so yeah, the decision part, I agree with everything you said, and I don't know, whatever works for you, but it needs to come from them, I guess, is where I land on it. And um, maybe not, maybe people wouldn't have the urge to bite their tongue or need to bite their tongue like I did in those conversations. Like, everybody's different. And that just underscores the idea that this is all so very intensely personal. Um,
Yes.
like the entire process. So, but then once we've had the decisions, as you were saying, Perry, the documentation. So, um, what does that look like? I mean, there are some required documents, right? And my words, I'm not necessarily using those in official capacity, but there are a couple required documents for advanced care planning. Um, I guess start like what are those? What are those?
Well, it, there's there could be a few. I would start with advance directives, and had to pause there because so often I end up saying advanced directives, which I've
Yeah.
been fixed on that for a long time. But pretty much it's like a living will.
Mhm.
And what it is it just kind of spells out exactly what your healthcare wishes are, what kind of life support treatments you would be interested in, different, various situations. You can also detail some things in there that are just particularly important to you. And again, it kind of goes back to that question of like, do you want to live as long as you can, or is the quality of the life that you're living,
Mhm.
where are you finding that balance between the two? Another one that comes up all the time is a healthcare power of attorney. If you or your loved one do not have this, do so please as soon as you can. This pretty much just it lets you name someone that you trust. So that could be a
Mhm.
spouse, a family member, a very dear friend, a partner, whatever it is, and they're going to be your agent or your proxy. So if you can't make a decision at a certain point in time, no matter what it's for, it could be, doesn't have to be a big disease. It's just you can't make a decision right in that moment, that they can make a decision for you in that moment.
Mhm.
And a lot of times, most people have already filled these out. If you've gone to have an elective procedure somewhere, most likely the hospital had you fill one of these out. Who are we going to ask if you can't answer a question
Mhm.
for us? So there's a chance that you might already have filled this out somewhere. But if you have, or if you need to fill out another one, please do so. It's really useful in a variety of situations.
Yeah. Um, and to your point, I think the point you were making earlier around like the advanced directive, for instance, on its own, it's not a guide per se, right? But like depending on where you get the forms, and we'll talk about that in a minute, various options for that. But depending on where you get it, there may be sort of an amendment that gives you sort of instructions or a guide for how to think about it. But the
Oh yeah.
form itself also provides just inherently some context, I feel like. And when you're talking about, you were making the point earlier, Perry, about like uh, trying to use specific situations or specific hypotheticals
Oh yeah.
to frame your discussion with your loved one. These forms kind of do that when you're filling them out. Which, so all that to say, I guess
Yeah.
it's not as daunting as
No.
as it might sound, given the formal name, advanced care planning and advanced directive, and like all these sort of
Yeah.
things.
I
Um,
mean, and then I just don't want to miss the opportunity to bring up there are some other things that you can look at as well. Like everybody knows or is familiar with the phrase, I feel like DNR, but a do not resuscitate. This
mm,
is another document that you may or may not want to fill out with your loved one. I usually think having your wishes there is very important. Usually those are really good, especially if you have a frail or someone in your life that has a serious medical condition.
mm,
Um, Often, again, like for any reason, if you were at a rehab or skilled nursing, usually they do request that you complete that paperwork as part of their admission process, even. And they'll walk you through that too. They have social workers there that can assist you with kind of having that conversation if you need to. Personally, I think it's helpful to not be in a high stress medical situation when you're first looking at these
yeah,
forms. If you can do it beforehand, it's better. But even if you're in the mix, right, and things are, you're in a certain situation, there are people that can help you in that moment as well.
yeah. Um, and I guess on that note, though, what would, in the latter scenario, if this stuff hasn't been done and you find yourself in whether it's emergency or just a moment, as you're sort of painting that picture there, Perry, what would someone say? Like, what would they ask for? Who would they ask? Like, just anyone? Like,
Well, a lot of times the a medical center will come to you
okay,
about these questions. But if you already have this paperwork, it is so important to have it easily accessible. So in case of a crisis or an emergency, that you can bring it with you and reference it in the moment.
yeah,
That's a really just like is one of those like basic things that you have to organize and get on top of as a caregiver. Having documents ready to go in case of any situation is a good thing to be able to do or to have access to. But again, listen, sometimes things happen and we are not prepared for them. I know a lot of people who were caregivers and completely out of the blue because of an emergency. So
hmm,
talking it through with the social worker at the hospital or at the skilled nursing to have, some assistance and guidance about what these things mean, how to fill them out, what you can fill out at that point in time. Always ask for help. Anytime you're in a medical center of any kind, um, I always say to advocate for yourself and advocate for your loved one by asking, who can help me with this? I need
yeah.
clear an explanation. How can you help me with this? Because by asking, you will get the guidance that you need, hopefully.
And if you don't feel like you do, keep asking. Would be the last sentence I would say there.
A
Yeah,
100%.
yeah, yeah.
Um, if
Are
you
there?
don't ask, you don't get, and sometimes you have to ask a lot of times.
Yeah, yeah. Um, Sad but true in some cases, but uh, like Nike, just do it. So are there any other documents? Like, what about like POLST and MOLST? I've heard those acronyms. So physician's orders of life-sustaining treatment. Like these are
Yeah.
considered advanced care planning documents as well, right?
Yeah, they are.
Yep.
And sometimes, it's important there is some nuance to what state you're in,
Mhm.
and what documents are most appropriate. Some of them are kind of across the board. Some of them need like addendums to them in different states. And I don't want that to be a hindrance. Like, I don't want to make it sound like it's too complicated by saying that. One of
Mhm.
a great tool that I like that we use a lot with our family caregivers is something called the Five Wishes, which is a very
Mhm.
conversational document that is set up like you're having a family meeting and you're having a conversation and it helps you go through. And that's pretty much goes across the board of states, but some of them ask for an additional sheet to be filled out for it, just depending on where you are. And again, the guidance on that is pretty clear as well. So
Mhm.
don't let that, what I just said, hold you back in any way or make it seem overly complicated. It's just important to, know what's going to hold for where you are.
Right. Love it. And it's fivewishes.org, is that right?
I believe so.
Yes, it is. So I'm just going to put that in the chat. Um, this might be a helpful resource. So that's in the chat for everyone to see. Now, so, that was a very nice segue, Perry. Thank you. Because, we've talked about, well, just recapping what we've covered here, and we've covered a lot of ground in the last 25 minutes, but um, advanced care planning is more than just the documents, right? It's uh, and for my money, it's the discussion and getting to the decisions are really the sort of biggest chunk of it. That's Matt's perspective, um, but that's how I feel about it because I found those parts like that just felt big and heavy and tough. Um, and it wasn't as big and heavy and tough as I thought it was initially. But the documenting is kind of the easier part, right?
Oh yeah.
So, and you mentioned Five Wishes, which is a tremendous resource that I know you and the Care Advocate team use or refer to often. What are some other ways that people could get the forms?
Um, well,
Uh,
you could talk to your doctor.
yeah.
You could talk to a care advocate, a Carallel care advocate if you have access. Social workers often have these. Um, I've been to senior community centers where they'll do entire presentations based on this,
Mhm.
and have people come out and help you with your documents if you ask for them. There's a lot of different places that you can access these things.
Great. Okay. Um, well, look at that. We're almost right on time. It's 12:29 here on the East Coast. Um, so we've covered sort of the notion of having the conversations, hopefully helping your loved one get to those decisions, and then documenting them. Um, feel free to respond to your invite email if you have questions that you didn't get a chance or didn't want to ask in this forum. We're happy to help you out. Um, Perry, any closing thoughts on advanced care planning?
Nothing. I feel like I kind of spoke my way through it, but I would say just start by having the conversation. I know, Matt, you said it was one of the harder things for you as a caregiver, but just start by asking, even if they already have it, you know,
Hmm. Hmm.
hey, uh, spouse, parent, child, whatever, do you have those documents somewhere? Can I get a copy?
Yeah, love that.
And then you can skip most of it but also following up like, oh, and is it up to date? Is this still reflect what you want?
Yeah,
Like that's where I would start. And if the answer is no, then it's just following up with like, let's set up some time to do this. It would make me
yeah,
feel so much more confident and comfortable in being able to help you if I ever
yeah,
need to. That's
yeah.
all.
I love it, Perry. And that sort of ties into what my parting thought would be was just to reiterate that sort of idea of the peace of mind that came from it. Um, for me, it was peace of mind while I was caregiving, and it was I really can't even describe the peace of mind and like how it made me feel when my mom was coming towards the end of her life, and I was actually having to make some of these decisions. Um, that was just it's kind of indescribable to know that I was doing what she wanted in that moment. So if you haven't, your loved one hasn't, hopefully this conversation and today will be sort of, maybe a little bit of a spark for you to try and tackle this caregiving task. So, um, and last but not least, we will be doing this again on November 21st. And I just put a link to our schedule on Carallel.com. November, we're talking about 5 ways to reduce caregiving expenses, which I think is a topic anybody could get behind and benefit from for sure. So we'll look forward to that on the 21st of November at noon. So with that, Perry, thank you. I really appreciate
Thanks for
it.
having me.
Yeah, thanks for coming. Thanks for all your perspective. And everybody who attended, it's great to have you here. Thanks for attending, and we'll see you again soon. Bye, everybody.
Bye.